Hello everyone, welcome to OBN's special edition. Today I'm joined by Federal Health Minister, State Minister, His Excellency Dr. Dereje Dhuguma. We're going to discuss on the health matters across the country. Stay tuned. Excellency, thank you for joining us.
Thank you.
All right, just to begin with, could you brief us the level of health coverage across the country?
Thank you very much. First of all, I would like to thank your organization to make an arrangement for us to deliver our message to our community, especially on current issues related with outbreaks and also other important issues. So the first issue on the health coverage is quite very important. As you know, Ethiopia, the government of Ethiopia invested a lot in improving the health sector. For example, if we take the coverage at health post level, this time we have more than 20,000 health posters, and they are equipped with at least 2 health extension workers. And it's about 96% that we have covered in terms of population that have been covered by health posters, because one health post serves more than 5,000 people. When we see at health center level, we have 4,100 health centers, and the coverage at health center level is about 93%. So you know, we have some difficulties in pastoralist areas, in hard-to-reach areas, and in conflict-affected areas. But in general, the accessibility at health center level is more than 93%. And finally, at hospital level, we have 420 hospitals across the country. I'm talking about government facilities, but of course, when we add hospitals of the private ones, the figures could go a little above what I'm mentioning. So at that level, the coverage is around 90%. So this is just a potential coverage, or coverage in terms of the facilities serving the community. But when we see the infrastructure and also the healthcare workers working in those facilities, and also in terms of inputs, medical equipment, the exact coverage may be lower, but this is a potential and a geographic coverage.
Talking of hospitals, recently the government has been giving the attention to expansion of mega hospitals across the country, especially the specialized and comprehensive hospitals across the country. And how important are these hospitals, especially higher officials and senior government officials and other people used to go to abroad for some medical treatments, and how important are these specialized comprehensive hospitals, especially in reducing setting?
Yeah, as I've told you, we have more than 420 government hospitals giving services for our community at different levels. As we know, the Ethiopian health tier system is a 3-tier system, and at the base of the tier system, we have a primary care system that encompasses hospitals, especially primary hospitals, health centers, and health posts. And at the mid-level, we have general hospitals. These general hospitals could serve a population like 1 million, 1.5 million. And the top on the tier is comprehensive specialized hospitals. We have few actually comprehensive specialized hospitals. And recently the government embarked on having more comprehensive specialized hospitals, big hospitals that could serve as a medical tourism center. As most of you may be aware of it, we have launched our 4th health policy. And in that health policy, one of the departure is having a tertiary care or quaternary care, where people couldn't go abroad for seeking treatment in areas where our people can get the high-level treatment. Recently, for example, we have inaugurated, His Excellency Prime Minister have inaugurated Bishoftu Specialized Hospital, and this hospital could avert abroad treatments and abroad referrals for many cases, including cardiac cases, including cancer treatment, high-level tertiary cares, including surgeries, and also orthopedic treatments, and of course, neurology treatments. That is one departure, and it's progressing very well. And this center has been equipped with state-of-the-art medical equipment, laboratories, and also health professionals. We are also mobilizing professionals from different hospitals and also from abroad. And recently, we have also inaugurated Arba Minch Comprehensive Specialized Hospital. That has also a very big capacity. And of course, there are many other hospitals which are under construction. For example, if you take St. Paul Hospital, there are many state-of-the-art buildings where we plan to make functional 3 specialist services. One is open cardiac surgery, which will be started through private-public partnership. There is also a nuclear medicine center in that hospital, and we are also planning liver and renal transplant in St. Paul Hospital. So these high-end and high-level tertiary services would benefit Ethiopians, and of course not only Ethiopians, they will also benefit neighboring countries, as there are no facilities also in neighboring countries. And that is one of the hallmark of the reform of the government in the health sector. So we'll be promoting medical tourism, and this will also prevent capital flight from the country, because when people go abroad, they need hard currency. So people will continue to enjoy their health in their country. And actually, we have many opportunities on this one. One of the opportunities is a commitment from the government. There are many investments, especially through public-private partnership, that will enhance those capacity. The fourth health policy and the medical tourism is also another opportunity that we have. The investors from different countries are also looking into this area to invest in Ethiopia. And also there is patients that have capacity to be treated in their country. So the benefit is quite very huge, not only for Ethiopia, but also for our neighboring countries. And also it will be a very beneficial activity for our community, because with their own local language and with their health professionals, our community will benefit in their home country.
Excellency, talking of the opportunities, now the capital of Mifune is also the seat of African Union, and also there is African Economic Commission, and is the third diplomatic capital in the world, and Africa's CDC is also here in the capital. And how do you see the cooperation, with these comprehensive and specialized hospitals, since the government has planned to, expand these health tourism?
Yeah, we have a very good collaboration with Africa CDC, and of course many other international organizations here in Ethiopia. As we have rightly mentioned, Ethiopia is a seat for AU and also many other international institutions. And actually, workers in these big institutions also need higher centers, medical tourism centers, to be treated. Most of them, they travel to different countries to get their own treatment while living in Addis. And of course, every year, more than 6,000, 7,000 Ethiopians travel abroad to seek medical services. So having this type of services in Ethiopia will benefit even the expatriates and also different nationalities while working here in Ethiopia. And of course, Africa CDC invests a lot, especially in terms of emergency response. Most of their mandates goes around emergency response. So we are working with them in a number of areas. For example, in our Ethiopian Public Health Institute, we are building a very huge modern laboratory that can detect any virus, including viruses like COVID-19. As you may remember, we have been sending COVID-19 samples for the first few weeks to South Africa to be detected. But now we have a big capacity in the country. Any viral illnesses, any bacterial illnesses can be detected in this laboratory, and they are also supporting us on this one. And also in cross-border areas, as you know, we have point of entries with our neighboring countries. In those areas, we are also building different laboratories that can detect any outbreaks and that can respond for that outbreak before it gets transmitted to the other areas. So we are working with them. They are also supporting us financially and technically in a number of areas. As Africa CDC is an emerging institute, we'll work seriously with them. And one important thing is, as you know, Ethiopia has embarked on local manufacturing of medical supplies. Africa CDC has a big interest on that one. We are working with them. And also, Africa CDC is supporting us on new vaccines, new technologies. For example, we have already started Shield Vax with the aim of producing vaccines locally in Ethiopia. And Africa CDC is also supporting in those new technologies and the new vaccine production in Africa and specifically in Ethiopia. As Africa CDC is based in Addis, we have already decided to take this advantage and to work more with them to get most of the benefits here in Ethiopia.
I see. Great. Recently, we have been receiving the outbreak of malaria in some parts of the country. And could you brief us things that has been done by the ministry to prevent more expansion of this malaria outbreak?
As you have said, currently one of the serious challenges of our country is malaria epidemic in different parts of the country. Of course, as you know, malaria has been with us for the last many years. It's almost a very old disease that have challenged our health system and also affected our community by large. So recently, especially over the last 3 years, the number of malaria cases has upsurged seriously. So I think people know that, especially in some of the regions, for example, in Oromia region, in Amara region, Southwest Ethiopia, in South Ethiopia, these are the 4 regions bearing the highest number of malaria upsurge. Over the last 12 months, or in 2016 Ethiopian fiscal year, we have documented 5.2 million malaria cases across the country. And actually more than 15 million people have been tested or screened for malaria. And we have treated them in our health facilities. And some of the reasons why malaria upsurge has been seen in Ethiopia are, the first one is a climate change, of course. So the climate change is a global phenomenon. WHO has recently published how climate change has resulted in upsurge of malaria in many African countries. As you know, more than 95% of increased case of malaria and diseases related with malaria has been recorded in African continent. So one is climate change. The second problem is the conflict in different parts of Ethiopia and also displacement that we see here and there. So this will disrupt malaria prevention and control program. And the third important challenge is biological changes around malaria parasites. So there is one new variant of malaria which is called Anopheles stephensi, which has been recorded in eastern parts of Ethiopia, and it was migrated from Djibouti and Middle East, and that is really resistant to the treatments and the chemical spray that we used to apply for prevention of malaria. And of course, there are some resistances to the chemicals that we apply in different parts of Ethiopia. So biologic variations and mutations in malaria parasite is also another serious problem. And also negligence among our community in terms of using ITN, insecticide treatment needs, and taking the medications properly will be another problem. And actually I have to also mention that distribution of medical equipment, medical supplies, including anti-malarial drugs to the remotest part and to conflict-affected areas is also a serious problem for us when there are some problems. So this may have contributed to upsurge of malaria. But actually there were many responses that have been given at different level, at ministry level and also at regional level. So one of the issues is advocacy creation, and also educating our community on the prevention and control of malaria. Right now, our people are way more aware of the problems, and they are also working on environmental cleaning, environmental control that could avert the transmission. That is one success. And the other important issue is leadership commitment at all levels has been now increasing. So leadership, not only health leadership, but also administration at all levels is seriously following malaria every day. And we have also established emergency operation center in Ethiopian Public Health Institute that tracks cases and diseases every day from all districts. And we have prioritized 222 districts or waradas that bear more than 76% of the cases, and we are daily following these waradas. And one important success we have is, even though the cases are quite very big, as I've told you, more than 5.2 million, the death is quite very low because of the case management strictly being followed at all levels. We have treated these patients adequately, and anti-malarial supplies, drugs have been distributed to all health facilities without any problem. And for example, we have also distributed more than 20 million ITN, insecticide treatment needs, and we have sprayed more than 4 million households over the last 2 years. And surveillance following those districts every day has been enormous now. So we have tried all our best to at least make the case fatality rate very low. and the community is also now mobilized very well, and actually the media at all level has been advocating for malaria prevention and control at all level. And because of these all endeavors, the cases, even though the cases are very high, the days are very low, and we hopefully will control this epidemic over the coming 2 months.
Excellency, you are making great points on the question that I've raised, and now we are in winter season in Ethiopia, and there are also winter season related, disease, like there might be an outbreak of, flu and other, winter season related, outbreaks, disease in the country, and what has to be there and what expect from the community to stay healthy then?
Right, yeah. In Ethiopia, during the shift from the rainy season to the dry season, and also from the dry season to rainy season, epidemiologic shifts and disease patterns will happen every time. And during this winter time, so one of the serious issues is because of the temperature change, vector-borne diseases will appear. And one is malaria, and the other is flu in different parts of our country, especially in areas where people are living in crowded manner. In urban areas, flu will go high, and one is that one. And the other important issue is waterborne diseases that may happen, especially when rainy season starts or when it ends, because of the contamination of water with different impurities and with different parasites and bacteria. So that's very important for us. For example, cholera may happen as an outbreak in different parts of our country. Dengue fever may happen in some part of the country. And we also take a serious focus during this time for malnutrition, because our community, there is a shortage of food during those time until they harvest their crops. So malnutrition may also happen in some part of our country. So we follow our children whether they have malnutrition or not, and we supply them with different medications and different food aids. So what we are going to do for an adaptation and mitigation purpose is to educate our community ahead. So we are doing this through our media, through different strategies we have, and through the health promotion programs that we have. So we inform our community what to do and what to protect and what to prevent, at least in their household and also in their environment. And that's one thing. The other thing is to continue the different health programs, including vaccination program, treatment of children, especially for diarrhea, for pneumonia, and for flu in health facilities. Sometimes flu may get complicated to bacterial illnesses, so they need to be treated with adequate antibiotics and also with supplements, with different supplements. So right now we are equipping our health facilities with different antibiotics and vitamins and different inputs. So we'll continue this one. And actually one important thing is to follow strictly those disease patterns, especially flu, cholera, and dengue fever. So we are receiving reports from all facilities, including government and non-government facilities. And then if there is any signs, we follow that pattern and we try to localize the infections where it is reported.
Recently, Prime Minister Dr. Abiy Ahmed has introduced a project called Clean Streets and Healthy Life. And this project and this initiative has been adopted in some hospitals, even here in the capital, Finfinne. I have read, reportings that has been done here in, hospital in the capital, Finfinne. And as a health professional and as a minister, and who has rich experience in this regard. And could you brief us, the benefits of these initiatives for the public at large?
Yeah, thank you for that important question. So first of all, I would like to thank our Prime Minister for bringing this important initiative to our country. And actually, both initiatives, the corridor development and clean street healthy life, will benefit the health sector in many ways. And especially with the clean streets, when we say clean streets, those streets should have adequate toilets, public toilets, and they should be clean, and also they have to be open defecation free areas. And as we have said, we have also started this movement in 2 hospitals in Addis, in St. Peter Hospital and in Alert Hospital. and we're about to launch in more hospitals, about 10 hospitals, also at regional areas. And we have already laid foundations for some of the hospitals. I think one of the biggest benefits is to decrease transmission of communicable diseases, including diarrheal illnesses and outbreaks like cholera, and it will promote healthy life for our community. So those green and comfortable environments will benefit both the community, patients, and also health providers, including healthcare workers. And that is the biggest advantage. And in general, they will decrease mortalities and morbidities, and they will take Ethiopia one level up in attaining SDG by 2030. So ultimately, through these big initiatives, we aim to decrease deaths and diseases in our community. About that one, I mean, the benefit is obviously people will make exercises on these streets, and social cohesion will improve, and also mental and psychosocial wellness will be observed. There are different studies that show cleanliness and mental and psychosocial healthiness or well-beingness to be improved. So in general, it will improve the livelihood of our community, and also this transmission will be interrupted. Mental and psychosocial well-beingness will improve in those implemented areas.
The other mega agenda that has been undertaken by Health Ministry is health insurance, public health insurance, and this has been, undertaken in different regional states across the country. And how important are, this health insurance and, the public awareness about this insurance?
Yes, I think over the last 1 decade, one of the departures that we have seen in the health sector is implementation of community-based health insurance system. And this system have benefited in general all the community, but in particular the indigents, the poor part of our community. Just to mention the sectors that we have over the last 12 months, 2016 Ethiopian fiscal year, more than 1,000 districts or waradas have implemented CBHI, community-based health insurance. And 55 million people have benefited from this scheme, or they have been covered by the insurance scheme that we are rolling in Ethiopia. And this roughly goes to like 12 million households have benefited, or they are already insured through this mechanism. From this, more than 2.2 million households are the poor ones that cannot afford to pay for their health service. So you can see how far this scheme has benefited the poor segment of our community.
The Ethiopian government has introduced, a grand macroeconomic, reform recently, and we have been, hearing the shortage of, important drugs in the country. And how important, this macroeconomic reform, which, could solve the shortage of, forex in solving drug shortage in the country.
As we know, one of the challenges that we have in the health system is availability of medical drugs and medical equipment. But with a huge investment of the government on this area, especially through our agency called Ethiopian Pharmaceutical Supply Service, we are really progressing in terms of importing medical equipment and drugs, and also producing locally, and the progress is quite very promising. But the recent macroeconomic reform have its own benefits for the health sector, but still there are some challenges that have been brought by the reform. So we are seriously working with the macroeconomy team to mitigate the challenges that may come, because now with the changes in the currency, the available amount of money that we have in our bank may not procure the amount of drugs that we need for this big country. So we are communicating with them to have more subsidy and more additional resources, and there is a promise for that one. But one important thing is there are a positive side of it. For example, our wholesalers and pharmacies and different privates have more option to access the hard currency and to import medical supplies and equipment. But from the government, we may have some hiccups, but I'm sure with support from the macroeconomic team, we will have more finances, more capacity to get more drugs in the country, so that we will not have shortage of drugs at this critical time. And actually, one important thing is we have to also liberalize how we are operating. For example, EPSS, Ethiopian Pharmaceutical Supply Chain Supply Service, has its own regulations and proclamations, and most of these regulations are not that much friendly for us to procure drugs and medical equipment. But now, with this macroeconomic shift, we liberalize our institutions so that they can directly procure drugs from different companies in the globe. So that will be also another positive findings that we have seen. But in general, there are some positive things, but still we have to be very cautious with this reform, and we'll continue to take the advantage, but also to course correct the challenges that we see.
Finally, if you have a message to address as a ministry.
Yes, now Ethiopia is passing through very challenging times, especially with the reform and also with natural and man-made disasters in different areas. So I mean, our aim is to create a resilient health system that can really absorb the shocks and the challenges, as well as strengthening the health system at the same time. So in this critical time, we need coordination and also engagement from all stakeholders. I think the first one is the leadership at all level. Health system has to be seriously handled by the leadership at all level, including the regional presidents, the Warada and the zonal administrators. So they have to always prioritize health challenges. For example, response to outbreaks should be handled by the leadership at all level. It's not an issue of the health sector alone. So the leadership engagement in priority health sectors is an important matter to really pass through this critical time. I think that's one important thing. And the second important call is to our healthcare workers and health facilities to be open 24 hours to serve their community, even though healthcare workers have their own needs, which are not, which are serious needs actually. But during this tough time, we have to avail ourselves to serve our community 24 hours, 7 days. I know our healthcare workers have been doing this for the last many years, including during the response to COVID-19, but they have to continue delivering all their best for their community. And my call, another call, is for our developmental partners. As you know, most of the support for the health sector comes from aids, external aids, but unfortunately now external aids are declining. So I call upon partners to mobilize more resources to support this big country. As I always say, investing in Ethiopia is investing in Africa. Without improving the health system of Ethiopia, we can never attain that one as a continent, as an Africa. So more investment in Ethiopia through our partner is very important. And my call to the media is also to, for example, for the response for malaria and also other outbreaks, the media should deliver message to our community regularly, so that best experience could be scaled up to all other areas, and the challenges may get response from the stakeholders at different levels. So health promotion, health education, part of the health system have to be seriously be worked out with media houses at different levels. So the media also has its own significance in terms of addressing health issues. So we are just only 6 years away from SDG 2030. So by 2030, there are global commitments that Ethiopia had already signed, and we are approaching very fast towards that finish line. So we have to work hand in hand. We have to really coordinate each other, and we have to tell the world that Ethiopia has a capacity to decrease mortalities and morbidities, maternal mortality, child mortality. We have to prevent non-communicable diseases, communicable diseases, and we have to show our capacity to the global community in the health sector, and to shine this huge, big country to the global community.
Federal Minister of Health State Minister, Dr. Dereje Dhuguma, thank you for your great points and vivid explanation.
Thank you very much.
All right. Dear viewers, I hope you have got great lesson from our special edition with His Excellency Dr. Dereje Dhuguma, State Minister of the Federal Health Minister. This is all for today. Thank you for being with us.